Everyone worries when their pet must receive a general anesthetic and undergo surgery. Whether the procedure is elective, like a routine spay or neuter, or an emergency surgery to repair a life-threatening injury, it's natural to be concerned. Don't hesitate to make a list of questions that you may have for your veterinarian. This video may help to answer some of those concerns so that you are reassured that your pet will receive the best care possible and have a safe and comfortable recovery from anesthesia and surgery. Invasive surgeries will require your pet to receive a general anesthetic. To administer a general anesthetic is to render a patient completely unconscious and totally immobilized. Local injectable anesthetics can be used for very minor procedures, which are not discussed in this video. A general anesthetic, and any surgery, always carries with it some degree of risk. Significant advances in medicine and technology have led to improved protocols that are much safer for pets undergoing anesthesia. Your veterinarian will nonetheless try to minimize any risk associated with anesthesia and surgery. Screening for underlying blood and organ disorders, advanced monitoring equipment, and shorter-acting induction and maintenance drugs have all increased the safety of anesthesia. Better pain management strategies have reduced recovery times and improved the overall outcome of surgery in general. The first way the veterinarian minimizes the potential for injury to the patient is by determining whether there are any underlying health problems that may complicate anesthesia and delay recovery from surgery. Abnormal findings on a general physical exam, temperature, and heart rate can help reveal subclinical illness. Pre-anesthetic blood pressure and electrocardiogram, or ECG, are assessed before induction of anesthesia to detect abnormalities that may require further diagnostic investigation. Another way to ensure your pet's safety is to evaluate a blood chemistry profile before the procedure. This can detect compromised organ function, anemia, electrolyte imbalance, and bleeding disorders. Although it is impossible to screen for every possible disease process with one's blood sample, the most likely problems that would preclude or complicate surgery can be ruled out. The procedure can be delayed until the underlying illness is resolved, or the specific anesthetic protocol can be modified to protect the patient from complications of compromised organ function. Monitoring equipment used during surgery has also greatly improved the safety and outcome of general anesthesia. Pulse ox and end-tidal CO2 monitors verify adequate ventilation of the patient. ECG detects heart arrhythmias and electrolyte problems that can signal serious trouble during surgery. Blood pressure measurements ensure adequate tissue perfusion and are quicker at assessing the depth of anesthesia than subjective observations. Finally, trained technicians constantly monitor vital signs and report to the surgeon any unexpected changes. The drugs used to induce and maintain anesthesia have become far safer as well. Induction agents and gas anesthetics are minimally metabolized by the body and are eliminated very quickly compared to older drug protocols. A rapid recovery reduces the chance of anesthetic injury to the kidneys and other organs. The pet is able to return to eating and drinking shortly after the procedure, which prevents dehydration and boosts the immune system during healing. For most anesthetic procedures, an endotracheal tube is passed through the mouth into the windpipe to provide an airway and connect the patient to the gas anesthetic machine. This also provides a source of pure oxygen to the patient, which improves ventilation and tissue perfusion. Generally speaking, gas anesthetics such as isoflurane and sevoflurane are safer than injectable anesthetics. Injectable drugs take the body longer to eliminate. Except in the case of reversible anesthetics, the specific anesthetic protocol is up to the discretion of the veterinarian, with the patient's safety being the first priority. Anesthetic agents cause a drop in blood pressure, which can reduce tissue oxygen perfusion. This may lead to organ dysfunction if not detected and reversed. During anesthesia, intravenous fluids are administered through a catheter to maintain blood pressure and prevent damage to the kidneys and other organs. In the case of an emergency, life-saving drugs can be administered through the IV catheter. Analgesia, pain control, is better achieved through the drug choices that veterinarians can utilize. It's a proven fact that pain suppresses the immune response, slows healing, and increases recovery times. Your pet will receive pre- and post-operative pain medications that will ensure their comfort and improve the outcome of surgery. The veterinary staff will give you specific instructions to follow before and after an anesthetic procedure. The pet will be fasted for a period of time to reduce nausea during anesthesia. Vomiting while unconscious is very dangerous, and an empty stomach will avoid this problem. Withholding water for too long before surgery can lead to dehydration, which may cause problems with recovery. After surgery, you will be given aftercare instructions. Restricted activity, physical therapy, antibiotics, pain medications, rechecks, and scheduling suture removal are common follow-up procedures to a surgery. An Elizabethan collar may be sent home to prevent the animal from chewing and scratching at the incision. You'll want to monitor your pet's appetite and attitude afterward, and call the vet if there are any problems. You should understand what will be done during surgery and the expected results. Discuss the procedure with the veterinarian and the nursing staff so that you're comfortable with your part in the follow-up care of your pet. Veterinarians are very well equipped to keep your pet healthy and safe during anesthesia. While anesthetic injuries do occur, they are becoming much more rare since the health of the patient is first assessed. Safer drugs are available, and careful monitoring of vital signs using better technology is possible. Combining these improvements in anesthetic and pain management protocols with the owner's diligence during recovery, the risk of general anesthesia and routine surgery should be kept to a minimum.